So, the last video I recorded was my official suicide as a protest, and I needed some things to happen before I could actually check out. One was a medical power of attorney, so I could have someone pull my health records and my health records and request an autopsy. There's actually a little more work in requesting an autopsy. It doesn't cost anything. I think it helps to have the hospital lined up. And you have to know the policy for that hospital. I could be wrong. And I don't know that medical power of attorney covers it. So we got to revise some things. There's actually a little bit of work for self-elected suicide. I'm not going through some vendor to do it. Which brings me to the topic of thoughts on depopulation and the value, the intrinsic business value of a suicide kit. When it comes to this concept of depopulation, I'm not a huge fan of conspiracy theory because I'm a researcher. I don't like things that aren't fact. I do like them. I see them as clues. They're assumptions to go be validated. And so, what kind of an animal would put suicide kits out there? Here's the intrinsic value to the business of depopulation. Now, if there is an agenda to essentially disease and poison people, synthetic or organic parasites, whatever it is, I think people have been euthanized for years, unknowingly. If we need to cut the world's population in half, why not offer a suicide kit after you've done the spreading of said disease, whatever the business of putting the disease out there? Offer the suicide kit at least so I can die a hero painlessly and without having to do something like take 1,000 ibuprofen or build a death mask out of a helium tank. I could get it wrong, I thought about self-immolation, like burning myself in an act of protest like the monks did. Suicide as a protest. But here's the thing, right? There's so many people out here suffering. If you're really not going to give me health care, if you're really not going to offer me medical relief while I'm seeking it so I can go back to paying $50,000, $60,000 a year in taxes from my amazing tech worker salary, then at least offer me a suicide kit so I can die a hero. And you'd want to build a narrative around this, that the people that offer their lives up, for the sake of reducing the world's population, die as heroes. You could even incentivize this, pay money to the families, the people left behind. The sick and the elderly might go first. You might find some people, who knows, people facing death in prison. You might have so many heroes step forward, it could become a miracle in itself. Now, I do want to say that I think differently. I come from, I'm a black belt in martial arts. I have a warrior mindset. Suicide is not really an option for me. But one thing that I'm really not interested in doing is living a life of poverty again as a sick person and spreading my filth around. I recently came across some dewormer in some methamphetamine, some clear. And it took me by surprise. But my body ejected a whole bunch of worms. I had called an ambulance because I didn't know what was happening to me. I took photos of it, a bunch of tiny black worms, and some white ones. I called an ambulance at the Civic Center station in Denver, and one showed up, and these people were such assholes. The guy comes out, and I try to explain that I don't understand what's happening to me. I can't see. I've got stuff coming out of my face, my eyes, my legs. I don't feel well. And he says, why don't you go wash your face off and walk down to the hospital, walk down to Denver Health End. This is one of the EMTs. Again, this compassionless society hell bent on not enabling, even enabling healthcare. Forget relief from suffering for the general homeless person. I nearly puked in my mouth, and that is what I did. I walked to Denver Health. They gave me some Benadryl, the symptoms subsided, and then I sat on a ramp at the Salvation Army homeless shelter waiting to get in at 4 a.m. I went from that experience to being kicked outside in the cold with a t-shirt. I got a couple blankets from the emergency room. I think, and I went and I walked down to the ramp, and then I sat there. I ended up being number 5 in line. They were only accepting 4 people. I begged for my life. I waited, and they let me in. I took a shower and started rebuilding myself, and now I'm starting to feel better, a little better. But I'm still facing the fact that I don't have health care. And I'm sitting here, I uploaded the suicide as protest video. And I had someone set up to do the medical power of attorney. And I love this person very much, but they are also struggling. And I can't just give this task of like, look, when you get a phone call and it's me, I've passed, right? And I need you to make sure an autopsy happens, and I need you to get all my digital accounts together and communicate with my family. I need this person to be on point and to want to do it, and they can't doubt what I'm going through. And I'm literally finding that this person I need doesn't exist. It really sucks, and I wish there was a suicide kit, some formal way to acknowledge this horrible loss. I beat 16 years of IV drug use, hopeless suicidal depression, to go on to become a black belt and a 6-figure tech worker, running my own executive meetups and things like this, and I don't know if I'm making it out of this thing. I don't have a family member or a friend in the world that would give me $1. And the people that know and love me are extremely doubtful that there's anything wrong. In fact, I can't really get them to look at the videos. And so I'm recording this, to really just, I don't know if these videos will ever get to anyone, but I think there's incredible value in a suicide kit in America right now. In fact, any country that is participating in the agenda they call the war on drugs, and where healthcare is profiling patients for homelessness and throwing out diagnoses without doing any work, like parasitosis. Well, if I've got parasitosis, wouldn't you have to prove that there's not a parasite present? Wouldn't I have to go through the same channels, the infectious disease team I can't get an appointment with, to prove it? And if I found those people today, would I trust the word they say? I don't know. I don't know if I would. I don't think so.